Introduction: Understanding the causes and treatments for leg, ankle, and foot swelling. Swelling in the legs, ankles, or feet can stem from various causes, including injury, infection, heart issues, kidney problems, or other medical conditions. The appropriate treatment depends entirely on the root cause. If swelling is frequent or persistent, it's essential to consult a doctor. They can identify the cause and recommend an effective treatment strategy. This article explores the potential causes of leg and ankle swelling and discusses common treatment methods. Number 1. Heart failure. Swelling in the lower limbs is a frequent symptom of heart failure. When the heart struggles to pump blood efficiently, fluids can accumulate in the body, especially in the legs, leading to a condition known as edema. Treatment options. Though heart failure isn't curable, it can be managed through various approaches, including lifestyle modifications, such as increasing physical activity and following a low-sodium diet, medications like beta blockers, surgical procedures, such as coronary artery bypass surgery, implanted devices like a left ventricular assist device (LVAD), heart transplantation in advanced cases. Ongoing care from a cardiologist is typically necessary for long-term management. Number 2. Liver disease. The liver is responsible for producing albumin, a protein that helps retain fluid within the blood vessels. When liver function declines, albumin production drops, causing fluid to seep into nearby tissues, resulting in swelling in the feet, ankles, and legs. Often, liver disease presents no symptoms until significant damage or cirrhosis has occurred. Treatment options. The only definitive cure for severe cirrhosis is a liver transplant. In earlier stages, treatment may include prescription diuretics like spironolactone, aldosterone, or furosemide Lasix, a low-sodium diet to reduce fluid buildup. 3. Kidney disease. The kidneys regulate fluid levels in the body and maintain the balance of salt and minerals. When severely damaged, they can't filter the blood effectively, causing fluid and waste products to accumulate, often visible as swelling in the lower limbs. Treatment options. Treatment depends on the underlying cause, often linked to conditions like high blood pressure or diabetes. Doctors may prescribe medication to manage these conditions and slow kidney damage. If chronic kidney disease (CKD) progresses to kidney failure, dialysis or kidney transplant may be required. Number of foot or ankle injuries. Injuries such as a sprained ankle can lead to swelling in the foot, ankle, or lower leg. A sprain commonly results from a sudden misstep during walking, sports, or exercise, causing ligaments to stretch or tear. Treatment. The Rice method. Rest. Minimize movement to avoid further injury. Ice. Apply an ice pack wrapped in a towel for 20 minutes, at least 3 times a day. Compression. Use a compression bandage to reduce swelling. Elevation. Keep the injured limb elevated above heart level to decrease swelling. Number 5. Infections. Infections affecting the feet, ankles, or legs such as cellulitis can cause visible swelling. People with diabetes are particularly vulnerable and should inspect their feet frequently for injuries. If an infection is ignored, it may lead to gangrene, where tissue dies due to infection or poor blood flow. Treatment options. Treatment depends on the infection's type and severity. For bacterial infections, doctors typically prescribe antibiotics. If gangrene develops, surgical removal of the affected tissue may be necessary. Number 6. Lymphedema. Lymphedema refers to swelling caused by a buildup of lymph fluid in the tissues. This occurs when lymph nodes are damaged or removed, impeding fluid drainage. It can lead to a sensation of heaviness and visible swelling in the affected leg. Treatment options. Management strategies include wrapping or bandaging the leg, wearing compression stockings, lymphatic massage, light exercises to promote lymph flow, skin care to reduce infection risks. Number 7. Venous insufficiency. In healthy veins, valves prevent blood from flowing backward. When these valves malfunction, Blood can pool in the lower limbs, resulting in swelling, particularly in the legs, ankles, and feet. Additional symptoms might include skin ulcers, discoloration of the skin, risk of infection. Treatment options. To promote healthy blood flow, treatment may include leg elevation, increased physical activity, compression stockings. Doctors might also recommend medication, depending on the severity and overall health. Number 8. Blood clots. A clot in a leg vein can cause noticeable swelling. Two types include phlebitis, superficial thrombophlebitis, a clot in a vein close to the skin; deep vein thrombosis, DVT, a clot in a deeper vein, typically in the leg. Warning signs of a blood clot: swelling and pain in one leg, a deep, aching sensation, warmth in a specific area, red or flushed skin behind or below the knee, skin color changes, mild fever. If a clot breaks loose, it can travel to vital organs, like the lungs, brain, or heart, becoming life-threatening. At higher risk, people are more susceptible if they are pregnant, are immobile due to surgery or hospitalization, have obesity, are elderly. Treatment options. Doctors usually prescribe oral anticoagulants to prevent clots from growing or forming. Common options include warfarin, rivaroxaban Xarelto, apixaban Eliquis, edoxaban Savasa, dabigatran Pradaxa. Cost may affect access to some medications. #9. Medication side effects. Some medications may cause swelling in the legs or ankles. These include hormone replacement therapy, birth control pills, steroids, blood pressure medicines, antidepressants. Treatment options. If you suspect a medication is causing swelling, consult your doctor. They might adjust the dosage or switch the medication. Never stop taking a prescribed drug without medical guidance. Number 10. Pregnancy. Mild swelling in the feet, ankles, and legs is common during pregnancy, especially later in the day or as pregnancy progresses. However, sudden or severe swelling may indicate preeclampsia, a dangerous condition marked by high blood pressure. Other symptoms of preeclampsia: swelling in the face and hands, vision disturbances, headaches, low urine output, upper abdominal pain, nausea or vomiting. These symptoms should be immediately reported to a healthcare provider. Preeclampsia typically resolves after childbirth. Managing pregnancy swelling: wear loose, comfortable shoes and socks. Engage in regular gentle exercise. Keep your feet elevated when possible. Avoid standing for long periods. Swelling in older adults. Older adults are more likely to experience chronic conditions like CKD and venous insufficiency, which commonly cause leg swelling. Venous insufficiency becomes more common after age 55. Chronic kidney disease risk increases from age 60. DVT risk rises after age 40. When to visit a doctor. Contact a healthcare provider if you experience sudden or unexplained swelling in one or both legs, ankles, or feet. Swelling accompanied by difficulty breathing, pain, fever. A doctor can determine the cause and suggest the best course of treatment. Can swelling be prevented? In many cases, lifestyle adjustments can help reduce or prevent swelling. Engage in regular physical activity. Elevate the feet when at rest. Wear properly fitting footwear. Avoid long periods of standing. Follow medical advice about diet, such as reducing salt intake. Summary with conclusion: swelling in the legs, ankles, or feet can result from numerous conditions including heart, liver, or kidney issues, lymphedema, infections, or injuries. Pregnancy, medication side effects, and aging also increase the likelihood. Although swelling can't always be prevented, healthy habits such as staying active, elevating the legs, and taking precautions to avoid injury can help. If you experience swelling, seek medical advice. A healthcare provider can diagnose the underlying issue and guide you toward effective treatment. If you found this video helpful, please like and share it with your friends and family who might benefit from this information. Don't forget to subscribe to our channel for more insightful health tips and updates. Your support matters. You can also appreciate our work by clicking the Join or Thanks button below with a small token of support. Remember, your health is in your hands. Small changes can lead to significant improvements. Take care of your body, nurture it with love, and allow it to heal naturally. Thank you for watching. See you in the next video. Till then, stay healthy and stay happy. Disclaimer: this video is for informational purposes only and is not intended as medical advice. Always consult your doctor or a qualified health professional before trying any remedies or lifestyle changes discussed in this video. Your health and safety are our priority.